Hello YouTube. Sorry about the darkness. Scoot in here. I need to lose weight. I'm gonna become a CNA soon. I'm studying for it. I haven't started the classes yet, but I'm trying to learn the terminology. I'm not a visual learner at all. I can't learn something by looking at it on paper. I have to hear it, and I'm also a kinesthetic learner. I'm auditory and kinesthetic, so I have to feel it, and I have to hear it. So I'm trying to learn all the terms, and just in case you're thinking about maybe doing CNA, you are in CNA, you need some terminology, I think I can be of some assistance. Okay, so I'm going to write it down on here, hopefully in the little boxes that pop up on the screen. But as for now, let's begin. I'm going to start with A's. I'm going to do like a page a day, so let's see. This is just a CNA textbook. Okay, so abbreviation. A-B-B-R-E-V-I-A-T-I-O-N. Actually, since I'm going to write it down, I'm not going to spell it for you guys. Okay, so it starts with abbreviation. It's a shortened form of a word or phrase used to represent the complete form. So, for example, AKA, right? AKA is also known as, or in CNA terms, it's above knee amputation. You know, when they cut above your knee, cut your leg off. Really hope that doesn't happen. The next one is abdominal prep. The procedure for making the patient's abdomen ready for surgery includes thorough cleansing of the skin and careful shaving of body hair in the abdominal area. Excuse me, I'm sick. So, for a lot of these, I noticed you can put them pretty much together. Like, for example, abdominal prep. Well, you're preparing the abdominal. Now, what would you prepare an abdominal for? Prepare it for surgery. You're not going to prepare it to, like, poke at it, you know? Well, unless surgeon poking at it. Anyway. And like this next one, it's really easy. Abdominal respiration. Breathing in which the patient is using mostly the abdominal muscles. Abdominal respiration. So abdominal being the abdominal, which is like the lower, and respiration. So breathing in through that part. This is where it starts getting a little tricky. Abduction. Now, a lot of people are like, well, abduction, is that where they steal the patient into another place? But that's not it. It's movement of an arm or leg away from the center of the body. I'm not exactly sure why it's called abduction, but it is the movement of an arm or leg away from the center of the body. Okay? Absorb. To soak in, up, or through. So everybody, these are a lot of these I noticed are really easy, like anger, you know, that kind of thing, anesthesia, accuracy, accountable, that kind of thing. I'm not going to spend too much time on the easy ones, but absorb. To just take in like a sponge absorbs water, right? Absorption. This is where it gets tricky. You would think it would be to take in stuff like that, right? No. Absorption does not work with sponges. It is part of the digestive process in which digestive juices and enzymes break down food into usable parts. Okay, let me try that again. Part of the digestive system, the process, in which digestive juices and enzymes break down food into usable parts. So yes, it is absorbing the nutrients out of it. So you can kind of see it like that. It's absorbing nutrients out of what you've eaten. Okay, acceptance. It's an easy one. Admitting, understanding, or facing the truth or reality of the situation, for example, one's death. So you have to accept what's going on. Yes, I have cancer, or yes, Uncle Johnny has cancer, that kind of thing. Accountable. To be answerable for one's behavior, legally or ethically, responsible for the care of another, right? So accountable as in you are accountable for your own actions. If you drop something, you're going to be held responsible. Accuracy. The quality of being exact or correct. Exact conformity to truth and rules, free from errors or defects. You have to be accurate. Now, a lot of you know what accuracy means, but just for those of you who don't, because I know there's a lot of English second language people going into this. Accuracy as in 2 plus 2 does not equal 5. That's not accurate. Accuracy, it's 4. Okay? You're gonna have to take blood the right way. You have to be accurate in taking it the right way. If you understand what I mean. You have to be accurate in the things that you do. Acquired immune deficiency syndrome, which is AIDS, right? A condition caused by a virus that destroys a key part of the body's immune response system. Viral infection characterized by decreased immunity to opportunistic infection. So, and I know a lot of people know what AIDS is, but they don't know how it is. They just know AIDS is very bad and it kills a lot of people. So what it does is there's germs flying around everywhere, right? A lot of them you don't even notice. What it does is all those germs that latch onto you, since it takes away your immune system, you die of pneumonia, a cold, a flu, because when you actually get better from these things, that's your immune system. But if the bacteria or the viruses are allowed to continue growing and your immune system doesn't take care of them, then they eventually kill you. It can be as simple as a cold. And AIDS, what that does is it takes your immune system away, so you die from things like a cold or a flu virus, something like that. So it's acquired immune deficiency syndrome, AIDS, AIDS. Okay, here we're under another easy one. Active motion, producing, involving, or participating in activities or movement. So active and motion, right? You're just moving around. Here's one of your abbreviations again, like we had AIDS, right? Activities of daily living, ADL. You have to remember that. It's ADL. For when you write on your charts, ADL. Activities of daily living. And that is the activities or tasks usually performed every day, such as toileting, washing, eating, or dressing. So just the regular things that you do in a day. Not watching TV, because not everybody watches TV. Everybody uses the bathroom. Everybody gets dressed. We're talking about normal people, not nudists. Everybody gets dressed. Everybody eats. Everybody washes, hopefully. Right? So, just everything. And these are the activities that a CNA person, certified nursing assistant, will have to perform. Okay. So you remember we had abduction, not the UFO's abduction, the movement of an arm or leg away from the center of the body. Now we have adduction, without the B, it's just ADD, adduction. Movement of an arm or leg toward the center of the body. Okay? So abduction, moving away from the center, and adduction, moving towards the center of the body. Admission. Okay? Admission, the administrative process that covers the period from the time the patient enters the institution door to the time the patient is settled. Okay. So, admission. This is from the time that they enter the doors of the hospice, the hospital, whatever, until the time they're hitting the bed that they're actually now in the place to be treated. So it's that time between entering and when they're settling down to begin the process of their healing. It's the admission. They go through all the files and paperwork and all that. Okay. Advanced directive. Pre-written instructions on withholding, resuscitation, and prolonging measures and equipment. Okay, advanced directive. If you give somebody an order, you're giving them a directive. And an advanced one means before. Like you put an advance on a house, right? That means you have to, that's paying before you're actually paying the house off. So advance directive is where somebody writes down or gives authority, no, don't resuscitate me if I die, I want to die, it's my time. So when they're having a cardiac arrest, which is a heart attack, the heart stops, the nurses might go in there saying, oh, let's revive him, use the technology, use the masks, as you guys have probably seen on the TV shows, use the amplifiers, use the shock treatment, mouth to mouth, pressing on the chest. The advance directive, if they've signed that or given consent to an advance directive, the nurses are not allowed to touch them. They have to let them die, because that is the person's choice. We're not allowed suicide in America. We're allowed an advance directive. Okay, we've already been through this one. It's AIDS, Acquired Immune Deficiency Syndrome. Remember that, AIDS, Acquired Immune Deficiency Syndrome. A condition caused by a virus that destroys a key part of the body's immune response system. Viral infection characterized by decreased immunity to opportunistic infections. A few big words. Think slowly, right? A condition caused by a virus that destroys a key part of the body's immune response system. Okay, so a virus attacks the immune system and it destroys it. Okay, so it destroys the immune system. Then, after a semicolon, viral infection characterized by decreased immunity to opportunistic infections. So now that it's destroyed the immune system, now all of a sudden, by decreased immunity to opportunistic infections. So now, opportunistic, that's the key word, infections. So now, because your immune system is decreased, you can catch a cold, which is an opportunistic infection, catch a flu, and be infected by whatever. And because it's decreased your immunity, now all of a sudden, you can't survive, and hopefully you don't die, but a lot of people do. So, in video number 1, we've been through abbreviation, abdominal prep, abdominal respiration, abduction, absorption, acceptance, accountable, accuracy, acquired immune deficiency syndrome, AIDS, active motion, activities of daily living, ADL, adduction, admission, advance directive, and AIDS. So if you can go through and you can pause the video whenever I'm saying those words and try and think of what they are, maybe it could be like a little test for you, I don't know, test yourself. But in video 2, we're going to continue on with the A's. So I hope you enjoyed.